Hi, I'm Dr. Vandita Samavedi, an internal medicine physician. We have a truly remarkable guest with us today, Dr. Megha Shah. She's a nephrologist, a healthcare leader, and someone who has a deep understanding of the role of complementary medicine in health and well-being. She's the founder of Saha Health for acupuncture and herbal medicine. Welcome to Haldi Living with Doctors Megha. Thank you for being here.
Thank you so much for your kind words, and I'm so excited to be here.
Thank you. So, Megha, you are a kidney and blood pressure specialist. Let me start with one of the questions that most people ask us. That is, how much water is the right amount for everyone to drink? I keep getting asked, should I be drinking 8 glasses of water every day?
That's a great question. And the answer is hydration is extremely important, but it's not a one size fits all. I would say we need to let our body guide us on how much water do we need to drink. So let our thirst guide us about if I'm thirsty, I should have some water. The other thing I often tell people who I see in my clinic is just look at the color of the urine. As long as the urine is light in color, that means your body is well hydrated. So it's not a particular number of glasses, but just how much your particular body needs based on, and that could vary from day to day.
Right.
Just, you've been out in the sun, you've been sweating, doing the workout, you might need more than on other days.
Absolutely. Something else that's very popular right now is proteins. A lot of people ask questions about how much protein, also taking a lot of protein supplements. Does eating a lot of protein damage the kidneys?
Yeah. So again, like everything that we consume, our diet needs to be individualized. If our kidneys are healthy, moderate amount of protein is good, actually, especially for women in menopausal age. Protein is definitely required for maintaining healthy bones and other functions. But when we do have advanced kidney disease, excess protein is hard for our kidneys to process. So definitely in those conditions, I would say limiting the amount of protein is prudent.
And absolutely talking to your physician before you take any supplements,
Yes.
especially if there's kidney disease or concern of that. That's very important. You're right.
100%.
Yeah. Talking about the same, like a follow up on that, is it possible that a person has kidney disease but they have no symptoms?
Yeah, interestingly, we don't feel any symptoms for kidney disease till our kidney function is all the way down to about 20 to 25%. So the symptoms start way too late in the disease course. So it is really important that we are having our kidney numbers screened, doing our blood tests, talking about it with our doctors, especially if we are at risk. So if we have conditions like diabetes, high blood pressure, or other similar medical problems, it's very important because we may not know that the kidney function is less till it's really, really low.
And also on that part, just doing routine screenings is good. But if somebody does find out from their physician and their routine checkup that they have a kidney disease, is there anything that can be reversed? Can we do something about it?
Absolutely. Early detection is extremely important because there's a lot we can do to improve kidney function or at the very least stabilize it where it is. So controlling our blood pressure, controlling our diabetes, avoiding certain medications which could cause worsening of kidney function, or sometimes some dose adjustments are required in medications based on your level of kidney function. Also, there are a lot of medications now in the setting of diabetes and some other diseases which can specifically help in slowing down the progression of kidney disease. So there's a lot that we can actually do, which is why that early detection of kidney problem becomes important.
Yeah, one of the big reasons why we, emphasize managing your blood pressure, diabetes, blood sugars, all of those will help the kidney function. You're right. Thank you. Yeah. How about salt? We all have a lot of salt in our diet, especially when we eat processed foods, go out, eat. What do you think? How does salt impact our kidneys?
Yes, as a kidney and blood pressure specialist, I feel very passionately about salt. Salt does increase our blood pressure. An average American diet has about 8 to 10 grams of salt, whereas the recommended amount of salt intake is 2 to 3 grams, definitely not more than 4 grams. So It's an ambitious goal to reach that level of salt intake, but extremely important because salt increases our blood pressure, which can directly impact the kidneys. Um, and excess salt is something the kidney has to work over time to get rid of it. And so salts can increase the chances of kidney stones, any kidney damage, blood pressure. So many reasons why we should really be watching our salt intake.
Yeah, eating in moderation.
Mm-hmm.
Maybe adding even spices that help us, flavor our foods, and not just adding
Yes.
salt is a simple thing we could do.
Yes, a lot
Yeah.
of people say that I need to add some salt to enhance the flavor, but there's so
Yeah.
many other things, and you know better than I, that can really enrich the food
Yeah.
flavors without adding salt.
Yeah. So maybe adding spices would be a good way to
Mm-hmm.
cut back on salt. When we are talking about kidney stones, are there any certain foods that actually precipitate kidney stones?
Yeah, extension of our conversation that we already were having, high amount of salt can definitely lead to kidney stones. There are some other elements in our food, like oxalates. They can definitely precipitate some kidney stones. One big myth people have is if high amounts of calcium in your diet can cause stones. And actually, even if you have kidney stones, the recommendation is to continue having normal amount of calcium that can actually prevent stones. So, I think we're good on calcium, but low salt, again, can't emphasize it enough. And if you've had stones before, low oxalate load in the diet.
Yeah, no, that's really important point because kidney stones, they're formed, there's calcium in it, calcium
Mm-hmm.
oxalate.
Yeah.
So those kind of things. But what you're saying is it's not like we have to decrease calcium. Actually, taking it would help rather
Yes.
than
Normal
that's
calcium intake helps
yeah,
prevent stones.
perfect. Yeah, thank you. I'm switching gears to something that you are passionate about. You're the founder of Saha Health, which has a
Mm-hmm.
focus on Chinese acupuncture. This is a very interesting combination. How do you see it supplement alternative medicine like Western medicine, integrating it with acupuncture?
Yes, through my journey as a physician, I actually recognize that there's so much opportunity to collaborate between Eastern medicine and Western medicine. I'm a big believer that prevention is better than cure.
Yeah.
You know, um, a lot of the role of Eastern medicine, including acupuncture and herbal medicine, focuses around just general well-being. So there is definitely a role in helping people feel better when they are when they are in pain, they are having sleep problems or anything like that, but also preventing some of these problems, improving the endurance of our body. So big role in that. I think as a lot of physicians, we often see patients where all the blood work looks good, blood pressure, everything looks good, but the patient is not feeling
Right.
good, right? And that's where I think alternative medicine has a big role. So I have recognized through my journey as a physician that there is a big role of both Western and Eastern medicine working together, because they both have a different role in our well-being.
Yeah, no, you pointed it very well because we all emphasize to our patients about preventive health. And this goes forward more by saying, let's do all the healthy habits to not even fall sick before trying to prevent a disease. So, very important topic, yeah. Tell me a little bit more about acupuncture because, as I understand, acupuncture was mostly used for pain relief.
Mm-hmm.
But what are the other things that it can be used for? What are your
Yeah, yeah.
ideas? Yeah.
Acupuncture actually has pretty vast applications in a whole variety of symptoms that we experience. Traditionally, like we've all known about role of acupuncture in pain management, whether it is acute or chronic. But some things we commonly see it being used for and be successful in is low back pain, joint pains, headaches, chronic migraines,
Mhm.
or just some pains related to like if you're extremely active, recovery after hiking, after some kind of intense activity, definitely a huge role in rehabilitation. So that is something that is very commonly known. But other uses are not as commonly known, where there is a lot of evidence actually that supports use of acupuncture and herbal medicine. The biggest one I would want to call out is women's health. So menopause and perimenopause, there's a lot of evidence that symptoms with menopause can benefit from acupuncture, whether it is sleep disturbances, stress, anxiety related symptoms, hot flashes, just mood changes that come with it. So, big role of acupuncture over there. There's also a role in fertility and dysmenorrhea and women's health in general. There are actually acupuncture specialists who can help with fertility treatments, work in conjunction with fertility clinics. Even in labor and delivery, during labor and delivery, there is a role of acupuncture. And then there's this other category of medical problems, like there is role of acupuncture in chronic nausea, chronic gastrointestinal symptoms. Some of the larger institutes like University of California and San Diego, they have an integrative medicine program for irritable bowel syndrome, inflammatory bowel disease. So definitely a lot of different uses. I would think of acupuncture as being helpful in anything which the way it acts is by improving blood circulation, by resetting our neurohumoral balance. So anything related to pain, just chronic symptoms, I would definitely consider acupuncture for it.
Those are really interesting. And especially in my practice, I see a lot of women who are seeking different approaches for managing the menopausal symptoms. Women are very interested to lead a healthy life and get the best possible care so that they can function well. So to know about acupuncture even helping and supporting women's health, and like you very well described, a neurohormonal pathway, and that's wonderful. Great to know, and I'm learning from you. Thank you.
Yes, it's so fascinating. The science of East Asian medicine is extremely fascinating. Different from Western medicine, but I definitely see them come together.
Perfect. I would love to ask you, what are some few simple things people can do to maintain good kidney health?
Yeah, I mean, we talked about hydration. So allow your body to guide you on how much hydration is needed. That's very, very important. I would say the second thing would be maintaining an active lifestyle. So exercise, weight loss, even if exercise is not towards weight loss, still there is some positive effects on our metabolic pattern in the body. Definitely avoiding certain medications. So really, I'm a big advocate of like using natural methods if we can for controlling pain or anything else like that. Or if we are going to use some medications, checking with your doctors whether that medication is okay for you to take. And then last but not the least, controlling your medical controlling your medical problems sooner rather than later, like blood pressure and diabetes. When we are younger, sometimes we get casual about it. But the sooner we control these medical issues, the better it is for our kidney health.
Yeah, excellent points. We are always talking to our patients about heart health, how to avoid, heart attack or strokes. Kidney is so important. And if we could just do these simple steps and be aware of what can keep it healthy, that would take us a long way.
Absolutely.
Yeah. So tell me something, what is your life mantra?
My life mantra, I think, is, it is from being a physician, from being a caregiver to family members, from being a patient myself. I would say one thing I've learned is that we have to invest in our own health. It's not a magic pill or something, right? We have to do certain things consistently. That's the investment we make in our health. We have to exercise, we have to eat right, we have to know what we are eating. We have to try natural methods of maintaining our body in a well state. And we'll be fine if we do that.
No, those are so important. And maybe as a busy physician, we also forget it, but we do advise all our patients. And what you're saying, such deep meaning to it. It takes time, it takes effort to maintain good health.
Right.
If there's one thing that you could ask all your patients or tell them, what would that be?
I think it would be similar to what I said. Take the time to take care of yourself. It's a big commitment, but it's a commitment we have to make to ourselves to maintain our health.
Yeah.
So we gotta do that. There's, instead of pushing it back to we'll do it tomorrow, we'll do it another day, we have to start today and invest in our own health.
Yeah, that's a great message. And like I said, it was really nice talking to you, learning from you also about acupuncture. I wish you the very best for Saha Health. And thank you again for joining us on Haldi Living with Doctors.
Absolutely. Thank you.
And for more content like this, please like, follow, and subscribe to our YouTube channel, Haldi Living. Thank you.